The top stories tonight in Y News. The country again records more than 5,000 new infections, pushing active cases to over 66,000.
The United Kingdom designates the P3 variant first discovered in the Philippines under investigation.
Private hospitals reduce their manpower over unsettled claims of the Philippine Health Insurance Corporation, or PhilHealth. The 21-year-old Georgia man who was charged with killing 8 people at 3 Atlanta area massage parlors in an attack that sent terror through the Asian American community.
Newly discovered strains of bacteria could help grow plants in space.
And woman gives birth to baby with COVID-19 antibodies. Good evening, Philippines and the world. Today is Thursday, March 18, 2021. I am Harleen Delgado.
Join us in the next hour as we deliver today's top stories around the country and in other parts of the world. I'm Angelo Castro III.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news. The total number of the total cases in the country of confirmed coronavirus cases in the Philippines grew to 640,984 after the Department of Health reported 5,219 new infections today. Of the total cases, 66,567 are active cases or those who are still being treated. The DOH said that 93.3% of the active cases are mild, 3.7% do not have symptoms, 1.2% are in critical condition, 1.2% are severe, and 0.64% are moderate. Deaths related to COVID-19 also jumped to 12,887, with 21 new fatalities. The recovery tally, however, rose to 561,530 as 439 more patients have beaten the illness. Meanwhile, based on FDA's update, there are already 240,297 healthcare workers in the country who were inoculated with the CoronaVac and AstraZeneca vaccines. The palace expressed confidence that the country could slow down the spread of the coronavirus with continued cooperation with health and safety protocols from the public. Rosa Lecons explains why.
The Octa Research Group predicted of having 10 to 11,000 daily COVID-19 cases by the end of March. Despite this, Malacanang is confident that the country will not reach the prediction, especially now that the local and national governments are stepping up efforts to prevent the further spread of COVID-19. According to presidential spokesman Harry Roque, the daily coronavirus cases could even be brought down back to 1,000 level from the current 4,000.
Gumagawa nga po tayo ng hakbang para wag magkatotoo yung mga projections. No? And I think the local government units already know what to do. So I'm confident na mapapabagal po natin. In fact, nakikita na natin na bumagal na. No? Hindi na po siya 5,000 plus, nasa 4,000 na yan. And I think we can further slow it down, no? Gradually, no? To 3,000 and then 2,000, back to the 1,000 level.
However, the palace also mentioned about the possibility of implementing stricter quarantine restrictions if the spread is not prevented, especially in Metro Manila, which is the epicenter of the outbreak.
If that doesn't happen within April, fix po ang ating mga formulas on quarantines. So kung talagang maging critical po ang ating healthcare utilization rate, then that may justify changing our quarantine status. But hopefully not po, no? Because I think the people and local government units and everyone now is contributing para mapabagal na yung pagkarat ng sakit.
Meanwhile, Health Undersecretary Leopoldo Vega encourages enhanced observance of minimum health standards of every individual. He said the people should prevent crowded places, do double masking if possible, practice social hygiene, and others.
If the alarm bells of Okta is there, it's already a measure that we have to do something now, because the future really depends on what we will be doing individually and as a community.
Meanwhile, the Interagency Task Force Against COVID-19 conducted a meeting today to discuss other efforts to intensify the response against COVID-19. This include priority list in the National Vaccination Program, implementation of temporary travel ban on all foreign nationals, issues in relation to the use of digital contact tracing app, as well as the request for overseas Filipino workers bound for high-risk countries to be vaccinated prior to deployment. Rosa Lico, UNTV News and Rescue. We serve the people, we give glory to God.
The Public Health England is investigating a new COVID variant previously reported in the Philippines after 2 cases were found in the country. Early Briones reports.
The United Kingdom said it detected 2 cases of the new COVID-19 variant called P3, which was first found in the Philippines. The Public Health England or PHE said it has designated P3 as a variant under investigation rather than variant of concern, adding that they are continuously monitoring the situation with international partners. One of the cases is linked with international travel, while the other is under investigation. According to PHE, those who shared the same flight as the Filipino traveler will be identified and notified. The P3 variant, which was first reported in Central Visayas, contains the mutations E484K, N501Y, P681H, and LGV141243, which the UP Philippine Genome Center or PGC said are likely to have functional significance. The PGC said further studies are needed to determine this new variant's effect on rate of infection, severity of the disease, and impact on vaccine efficacy of SARS-CoV-2. As of March 13, there were 98 cases with P3 variant in the Philippines. Of this number, 67 were in Central Visayas, where the mutations were first detected. Early Briones, UNTV News and Rescue. We serve the people, we give glory to God.
The Private Hospitals Association of the Philippines say the Philippine Health Insurance Corporation failed to pay private hospitals at least 6 billion pesos worth of reimbursements. However, the state insurer says the claims are miscalculated. Joe Anano tells us why.
Several private hospitals were forced to reduce their workforce, while some opted to implement limited or staggered basis of working hours among their employees. This as the Philippine Health Insurance Corporation or PhilHealth are yet to pay private hospitals at least 6 billion pesos worth of reimbursement from claims, which has accumulated from January to December last year. Private Hospital Association of the Philippines or PHAPI President Dr. Jose Rene de Grano discloses that several of their member hospitals are yet to receive the reimbursement from PhilHealth, affecting their operations. The group is planning to bring up the matter to the Congress to act on the unsettled debt.
Unfortunately po, talagang marami po mga members namin ang umaangal na, no? Kasi there was supposed to be a promise lagi na magbabayad sila, magbabayad. And then meron po diyan na supposedly nandun na sa portal, ibig sabihin nandun na yung pera. Hindi pa din nila ma-release yung amount. Yung po ang ina-ask namin sa government, sana naman tulungan kami na bayaran kami ng PhilHealth kasi these are reimbursements.
However, PhilHealth argues that PHAPI might miscalculated the amount to be reimbursed to private hospitals. In a statement, PhilHealth spokesperson Ray Baliana says that it appears that the private hospitals might included in their computation the deficient and denied claims. PhilHealth record shows that PHAPI accumulated 28.3 billion pesos claims from January to December 2020, and based on their latest data extraction, 24.9 billion or 87% of these claims were already paid. However, some 2.4 billion were either denied or returned to hospitals due to deficiencies, while 1.07 billion pesos is on process. The country's health insurance assures that the regional offices are consistently conducting dialogues with individual healthcare providers to help them to comply and to avoid claims being denied. PhilHealth adds that they remain committed to paying its accredited providers within the prescribed turnaround time, which is within 21 to 39 days. Prior to this, the Philippine Red Cross also complained over PhilHealth unsettled debt for payment on COVID-19 testing. Joanano, UNTV News and Rescue. We serve the people, we give glory to God.
Over 800,000 quarantine violators have been arrested in the Philippines since measures were imposed in the country in mid-March of last year. Most of the arrests were made in Luzon. Leah Ilagan reports why.
A total of 859,404 violators were apprehended across the country, a year after the implementation of the community quarantine based on a data released by Philippine National Police. Of the total, 152,998 were released for regular filing and 54,809 faced inquest proceedings. Luzon still had the biggest number of arrests with 490,993 violators, followed by Mindanao with 205,350 and Visayas with 163,061 arrested quarantine violators. PNP spokesperson, Police Brigadier General Ildebrandi Osana says, due to the rise of COVID-19 cases in the country, they will continuously implement the strict health protocols. In a random checkpoint, police personnel are inspecting if motorists and passengers are wearing a face mask.
Kailangan magdala po sila ng face mask at hindi po papayagan na kung sakaling ang mga magulang ay inahayaan din lang nilang walang face mask ang kanilang mga anak, pagsasabihan po sila ng polis. Posible po yan na hindi naman actually i-hold sila, maaaring pagmultahin sila, depende po doon sa local government ordinance.
Osana adds minors aged 17 and below are prohibited from going outdoors.
In general, bawal po ang mga bata na nasa lansangan, nasa pasyalan, nasa grupo ng kanilang mga barkada na hindi guided or kasama ang kanilang mga magulang, lalong-lalo na dahil pinagbabawal po ito sa ating panuntunan, no? Because of the spike of COVID-19 infection.
Parents of minors who were caught outside will need to appear to the police station to bring home their child. Leah Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
For those watching 24/7 live streaming on YouTube, please click the subscribe button you see on your screen and ring the bell for notification. You may also follow us on Facebook. Health officials in the government says there is no need to change the existing vaccine protocol after a health worker died from COVID-19 more than a week after she was vaccinated. Aiko Miguel reports why.
A vaccinee has to fill out a health declaration form and will undergo screening first before being inoculated against COVID-19 as part of the vaccination protocol. The Department of Health says they won't do COVID-19 testing prior to vaccination as part of the screening. The DOH gave the reaction after the reported death of a 47-year-old female healthcare worker who was vaccinated with Sinovac's CoronaVac vaccine on March 4.
Those who report exposure or show symptoms of COVID-19 are actually not recommended to be vaccinated, and they're actually requested to send home. So at this point in time, there's no changes in our protocol. And also, if you will look at any other country in the world, we don't do testing prior to vaccination as part of the screening.
Based on the investigation of the National Adverse Events Following Immunization Committee or NAFIC, the healthcare worker has comorbidities, diabetes, hypertension, and bronchial asthma based on her health declaration form. NAFIC Vice Chair Dr. Romel Lobo also says she died of COVID-19 infection and not due to COVID-19 vaccine. Based on her health record, she tested positive of COVID-19 last 2020 and also on February 2022. But then she tested negative of the virus last February 23. She was asymptomatic on the day when she was inoculated on March 4. She tested positive again for COVID-19 last March 8 but refused to be admitted. It was on March 10 when she was admitted. On March 13, she succumbed to COVID-19 infection.
The patient might have been exposed to a individual that she had encountered, and then she might be incubating or having asymptomatic symptoms at the time that she was vaccinated. She developed the symptoms after vaccination. So as I've said, the vaccine does not have anything to do with the infection.
The DOH says with these findings, there's no reason to suspend CoronaVac inoculation.
It's very clear from the report, there's no reason to suspend our vaccination program, as first, the vaccine is not what caused the death of our healthcare worker, and second, as DOH and FDA has continued to emphasize, the benefits of vaccination continue to outweigh the risk of us getting COVID, particularly severe COVID-19.
According to Food and Drug Administration Director General Eric Domingo, although one has been vaccinated, it does not give an assurance that a person will not be infected with COVID-19.
During the first few weeks after you're injected with the vaccine, you have no protection. If this is the time that your immune system is trying to develop. So talagang expected, no, na first few weeks after vaccination, your risk of developing COVID-19, getting the illness and getting severe illness or probably and possibly dying from it is the same as a non-vaccinated person.
The FDA has already informed Sinovac Biotech about the case and asked if there are history of similar cases in other countries. Experts are also advising COVID-19 survivors that they have to wait 2 to 3 months before getting inoculated. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, the Department of Transportation will intensify the implementation of health and safety protocols against COVID-19 on public transportation towards the end of March. Asher Kadapan Jr. tells us why.
The Department of Transportation expects an influx of passengers and motorists during the long holiday in April. DOTR Assistant Secretary Godes Libiran said they are leaning toward reactivating Oplan Biyaheng Ayos, which the department enforces during such holiday when a huge volume of passengers travel.
So ayun po ay way para po ma-alert yung ating mga attached agencies, hindi lamang po sa road sector, ganun din po sa air sector, maritime, even yung ating railway sector na i-intensify yung kanilang mga health, safety and security protocols para po ma-ensure yung kaligtasan at kalusugan ng ating mga kababayan.
The Land Transportation Franchising and Regulatory Board or LTFRB is set to meet with public transport drivers and operators to ensure that health protocols are well observed in their day-by-day operations. Land Transportation Office or LTO personnel will also be deployed at transport stations and terminals for the implementation of traffic regulations as well as the minimum health standards. The DOTR also continues to remind the public to adhere to the 7 commandments in public commuting. Wear a face mask and face shield, avoid talking, don't eat during public commute, vehicles must have proper ventilation and frequent disinfection, passengers with COVID-19 symptoms are prohibited, commuters must observe appropriate physical distancing or 1 seat apart if no barrier. Travelers are also advised to contact concerned local government units before traveling. Libiran explains that although travel documents from the Philippine National Police and originating barangay are no longer required in domestic travel, some local government units may still have additional protocols that travelers should know about, recognize, and follow.
Meron pong prerogative pa rin yung ating mga local government units na magpatupad ng mga additional protocols, like for example, yung kanilang mga testing, kung i-require ba nila na mayroong RT-PCR or antigen testing bilang additional layer of protection para po doon sa mga pumapasok sa kanilang mga area.
Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
The Manila Police District continues to enforce health protocols against COVID-19 as shoppers continue to flock to the Divisoria market. Janice Inhente reports.
People still go to the Divisoria despite the reported continuous increase in the number of COVID-19 cases. As a result, the Manila Police District has tightened their monitoring on the implemented health protocols. The MPD strictly prohibits those who are not wearing a face shield from entering the market.
Lahat po hindi po namin pinababaya makapasok po yung mga mamimili ng walang face mask at face shield.
According to Police Captain Kerwin Evangelista of Juan Luna PCP Divisoria, they have observed that shoppers now are more careful not to get infected.
Kahit papaano po ngayon, mas bumaba ng konti. Kasi mas aware na rin po sila dahil nga sa pinaigting po namin na implementation.
Sa loob naman po, may social distancing naman po. At saka sumusunod naman po sila sa protocol. Nakamas naman po, tsaka po naka-face shield.
Natatakot rin po kasi dami po mga tao. Umiiwas lang po kami. Iwas-iwas lang po para layo-layo.
Even though they know the risk is high, vendors in one of the largest market in Manila cannot stop their business.
Sinasaway po namin kasi napapagalitan rin po kami ng pulis. Kailangan po namin social distancing para po hindi tayo magkahawa-hawa ng sakit.
The MPD also reminds residents of the city follow the rules and wear a face mask and face shield when going out. Janice Inhente, UNTV, News and Rescue. We serve the people, we give glory to God.
Boracay now allows tourists to use saliva RT-PCR test on one of its travel requirements upon entry to the island. The Boracay Interagency Task Force approves the said measure as alternative to nasopharyngeal swab for reverse transcription polymerase chain reaction test for COVID-19. But tourists should take the test through the Philippine Red Cross or any testing laboratories approved and accredited by the Food and Drug Administration and the Department of Health. The Department of Tourism, meanwhile, expressed its willingness to support the funding for the procurement of an RT-PCR or gene expert machine for COVID-19 testing of the local government unit of Malay Aklan. The agency also recommended to the IATF to allow persons below 15 years and above 65 years old in going to the airport and flying from Manila to Boracay. The DOT explains that they should not be restricted as long as they have plane tickets, since the island is under modified general community quarantine. The Department of the Interior and Local Government, or DILG, said it has deployed additional contact tracers in Metro Manila to assist local government units, or LGU, in their response to the rising cases of COVID-19. DILG spokesperson Undersecretary Jonathan Malaya said the Philippine National Police will deploy 362 more uniformed personnel to various LGU contact tracing teams in Metro Manila to supplement their existing local contact tracing efforts. The Bureau of Fire Protection, another attached agency of the DILG, will also deploy an additional 100 uniformed personnel to the NCR contact tracing effort. At present, Metro Manila has a total of 9,386 contact tracers organized in 2,130 teams.
Retired Supreme Court Associate Justice Antonio Carpio will lead a coalition of opposition candidates seeking to challenge President Rodrigo Duterte's candidates in the elections next year. Dante Amento reports why live. Dante?
Diego's retired Supreme Court Associate Justice Antonio Carpio has joined forces with former Ombudsman Conchita Carpio Morales and former Foreign Affairs Secretary Albert Del Rosario to form a pro-democracy coalition called the Isang Bayan Coalition for the 2022 elections. The group slams the alleged failure of the government on the COVID-19 response policy in the South China Sea dispute and extrajudicial killings. Justice Carpio, the lead convener of the group, says they need candidates that will uphold good governance to bring back the economic development, uplift the people from poverty.
The Filipino people deserve a better government. There are Filipino leaders who can do a much better job of running the government, reviving the economy, creating jobs for our people, and defending our territory and sovereign rights in the West Philippine Sea.
para sa darating na halalan 2022. Sana magkaisa po tayo sa pagpili ng presidente at iba pang mga opisyales na tapat, marangal, maasahan, at may pagmamahal sa inang bayan.
Carpio adds they have already talked to Vice President Leni Robredo, Manila City Mayor Isko Moreno Dumagoso, former Senator Antonio Trillanes IV, Senator Nancy Binay, among others, as possible part of their national candidates from president down to senators, though these people have not yet decided whether to run for the next elections. But Carpio clarifies both presidential daughter Sara Duterte and Senator Manny Pacquiao are not qualified, for they are both supporters of the president, who is allegedly responsible for extrajudicial killings and wanted to change the constitution.
President Duterte is the exponent of authoritarianism. He has said several times that he will thrash the Constitution. We do not think that the daughter of the president will qualify under our coalition.
Malacanang has responded that it's too early to talk about politics in the face of the pandemic.
Well, napakaaga pa para mag-usap ng eleksyon at politika. Yan naman po aming sinasabi palagi. Isang tabi muna po ang politika habang nandito po ang pandemya. Kami po sa administrasyon, gawa muna, pandemya muna bago politika.
Diego, even PDP Laban President Senator Manny Pacquiao stresses though he respects Carpio's position, but it is allegedly not the best time to talk about these political lineups. And that's the latest live. Back to you, Diego.
Thank you, Dante Amento, for those updates.
In other news, the Overseas Workers Welfare Administration, or OWA, fears that if the current situation persists, its fund for returning OFWs might get exhausted by the middle of the year. Meanwhile, some lawmakers question the imposed cap on international arrivals beginning this Saturday. Arlene Delgado will tell us why.
In light of the rising COVID-19 cases in the country, the National Task Force Against COVID-19 ordered a travel ban for foreigners and returning overseas Filipinos who are non-OFWs. The arriving passengers at the Ninoy Aquino International Airport will also be limited to 1,500 per day starting Saturday, March 20 to April 19. However, some senators want to know the basis behind the cap.
If you're recommending na wag natin pauwiin yung ating mga kababayan sa bahay nila, sa kanilang lupang sinilangan, parang hindi yata maganda, parang inaamin din natin na it's not working yung quarantine program natin, yung testing na ginagawa natin, yung contact tracing natin.
We would request an explanation as to why this is so, because this is to our mind erroneous and prejudices our OFWs.
OWA Administrator Hans Leo Kakdak said they will abide with the memorandum and noted that the decision was backed by scientific data about the COVID-19 situation in the country. According to OWA, there are over 481,000 OFWs who have returned to the country due to the pandemic. And if the current situation continues for months, the OWA will be needing an additional funding for its repatriation efforts. The administration is asking for a 9.8 billion peso supplemental budget to continue its support on the OFW repatriation come mid-year. OWA shoulders the food and lodging expenses of OFWs in quarantine hotels. Kakdak says they are still working with the Department of Budget and Management, but no funds are available as of now.
We had sounded the alarm because we had tracked the inflow, outflow of our funds. And we could now safely predict that around the midway point, May or June, the 6.2 billion pesos will be depleted.
The senators have urged the DBM to look into tapping the contingency fund worth 13 billion pesos to augment the repatriation funds of OWA. Cabinet Secretary Ricardo Nograles vowed that he will raise the issue with the Interagency Task Force against COVID-19. Jorlin Delgado, UNTV News and Rescue. We serve the people, we give glory to God.
And for the news abroad, a 21-year-old American has been charged with murder after killing 8 people in 3 massage parlors in Georgia Tuesday evening, with police identifying 6 of the victims as being of Asian descent. Marvi Delfin will give us the details live. Marvi?
Has been charged with 8 counts of murder and 1 count of aggravated assault in the shooting spree involving 3 women and men at Young's Asian Massage in Woodstock, Georgia, as well as 4 other women killed in 2 separate attacks in Atlanta, Georgia. According to police, the suspect has confessed to the crime and told officials about his sex addiction, and he sees these locations as a temptation for him that he wanted to eliminate. 6 women of Asian descent are among the dead, raising suspicions of a hate crime. However, police said it is too early to determine if Long's decision to target the businesses were racially motivated. As of Wednesday afternoon, only half of the victims had been publicly identified. The sheriff's office in Cherokee County released the names of the 4 killed: Delana Ashley Yawan, 33, Paul Andre Michels, 54, Xiao Jiyan, 49, and Dao Yufeng, 44. In a news conference on Wednesday, Atlanta Mayor Keisha Lance Bottoms said that the parlors in Atlanta had not been on the city's radar as potential sites of crime or trouble. Bottoms added that she was aware of the suspect's claims that the shooting rampage were not because of racial prejudice, but she is taking that with a grain of salt. Moreover, the shocking violence could have been worse, as Bottoms noted that when Long was arrested, he was heading to Florida, where he seemed to be planning to carry out similar attacks. Long was initially identified through surveillance camera footage from one of the crime scenes, and after his images were posted to social media, Long's parents got in touch with the sheriff's agency to say they believed it was their son in the pictures. The mayor disclosed that she had been in contact with the White House about the case, and President Biden offered federal assistance in dealing with the crime. Back to you, Marielle.
All right, Marvi, thank you for that live report. Tanzanian President John Magufuli has died after weeks of uncertainty over his health and whereabouts. This report tells us why. In a televised address on Wednesday, Tanzania's Vice President Samia Hassan Suluhu announced that the country's 5th President John Magufuli had already passed away at the age of 61. The president had died of a heart condition which he had suffered for 10 years at a hospital in Dar es Salaam, according to the vice president. Opposition leader Zito Kabwe had spoken to Vice President Suluhu to offer his condolences for the death of the late president. He also expressed his recollection on Twitter towards the president's contribution to the development of their country. Tanzania's constitution states that Suluhu should assume the presidency for the remainder of the 5-year term that Magufuli began serving last year after winning a second term. Magufuli had last appeared in public on February 27, and top government officials had denied that he was in ill health, even as speculations swirled online that he was sick. He was known for urging Tanzanians to pray and just use steam inhalation and embrace local remedies instead to protect themselves from COVID-19. Tanzania stopped releasing COVID-19 infection numbers in April 2020, weeks before Magufuli declared in June that the country was coronavirus-free due to divine intervention. He refused to wear a face mask or take lockdown measures, but a week before he was last seen, Magufuli conceded the virus was still circulating after the vice president of the semi-autonomous Zanzibar was revealed to have died of COVID-19. Magufuli was elected in 2015 on promises to fight against corruption and boost infrastructure development. Mariel Latoza, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, a recent study shows that plasma donated by COVID-19 survivors is not effective to use in other patients as cure against coronavirus. Ia De Vera details us why.
The National Health Service Blood and Transplant in England has been encouraging COVID-19 survivors to donate their plasma, thinking that it can act as antibodies against coronavirus. However, a recent study shows that plasma has no use in treating sick patients. Researchers conducted the study from May 28 last year up to January 15 this year to 11,558 patients. 5,795 patients were randomly allocated to receive convalescent plasma, while 5,763 patients received usual care and treatment. According to researchers' analysis, there were no significant difference in 28-day mortality between the two groups. Both groups have a 24% of patients dying within 28 days. Also, it was found out that using plasma had no significant effect on the percentage of patients discharged from hospital within 28 days. NHS hospitals were alerted on Wednesday, and frontline doctors must be aware of the recent findings to avoid usage of plasma on treating COVID-19 patients. Professor Martin Landry from University of Oxford and Joint Chief Investigator for the research said on social media that although number of patients received convalescent plasma hoping for a better outcome, it's clear that hope does not translate into reality, and that is why they need to conduct trials to know rather than guess. Ia De Vera, UNTV News and Rescue. We serve the people, we give glory to God.
A woman in the United States gave birth to the first known baby in the world with COVID-19 antibodies. RK Lorca will give us the details live. Yes, RK, good evening.
Good evening, Mariel. A baby born to a mother in South Florida, USA, who is partially vaccinated with the Moderna vaccine was found to have COVID-19 antibodies. The mother, who is a frontline healthcare worker, received her first dose of Moderna vaccine in January during her 36th week of pregnancy. 3 weeks later, after giving birth, researchers analyzed blood from the baby's umbilical cord, and antibodies were detected at the time of delivery based on the article presented by the doctors. Mothers typically pass down antibodies to their newborns through the placenta during the last 3 months of pregnancy, which provides the baby with passive immunity. The protection is only temporary and the immunity decreases after the first few weeks or months, according to the Centers for Disease Control. Dr. Hilbert and Dr. Chad Rednick, who have submitted this case for publication in a medical journal, do not know how long the antibodies will last in the baby. Dr. Rednick says, expect cases like this to become common. Mariel, over the coming months, thousands of babies will be born to mothers vaccinated against coronavirus. But medical experts say more research is needed to establish the resistance to the virus. Back to you, Mariel.
All right, RK, thank you for that update. 4 strains of bacteria have recently been found on the International Space Station, which could potentially assist with the growth of plants in space during long-term spaceflight missions. Nina Bascon reports why.
According to a study from the journal Frontiers in Microbiology, the 4 strains of bacteria, 3 of which were previously unknown, belong to the Methylobacteriaceae family. They were discovered after microbes were taken from samples across the space station during the expeditions of different crews. Senior research scientist Katsuri Venkateswaran and planetary protection engineer Nitin Kumar Singh of NASA's Jet Propulsion Laboratory said the new strains may be biotechnologically useful genetic determinants to help with the growth of plants in space. It was further stated that the isolation of novel microbes that help to promote plant growth under stressful conditions is essential, especially in extreme places where resources are minimal. Not only do the Methylobacterium species help promote plant growth, but they are also involved in biocontrol activity against plant pathogens, helping plants withstand the rigors of space during deep space missions. Meanwhile, hundreds of samples of bacteria are still awaiting analysis on Earth, along with the potential of discovering new strains, with researchers hoping for the development of molecular biology equipment that would allow them to study the bacteria on the space station. Nina Bascon, UNTV News and Rescue. We serve the people, we give glory to God.
And those are the reasons behind the news in other parts of the globe. I am Maria Latoza, live from Perth, Australia. Good evening.
And those are the reasons behind the news, March 18, 2021. I am Harleen Delgado.
Reasons we deliver to you as they unfold. I'm Angelo Castro III.
Because we need to know, we will always ask why. I am William Theo. We serve the people, we give glory to God.